Castor's live telephone town hall on the coronavirus. My name is Laura Hopkins. I'm the Deputy Chief of Staff for Congresswoman Castor, and I'll be your host today. Thank you again for taking the time to join us. I want to start by explaining the format for this afternoon's call. If you would like to ask a question or share your story, it's very easy. Just press *3 on your phone at any time, and a member of our staff will assist you. Again, just press *3 to ask Congresswoman Castor a question or share your story. This is a live question and answer session with Congresswoman Castor, and in a few minutes, you will have the opportunity to speak with her directly, as well as to two experts that Congresswoman Castor has invited to join. We are fortunate to have with us today Dr. Ellie Marie Perez-Colon, Medical Director for the confirmed COVID-19 clinic at the University of South Florida, and also an assistant professor at the USF College of Medicine. We also have Dr. Anand, Executive Vice President and Chief Medical Officer for Baycare. We will bring those speakers on shortly. But remember, if you'd like to ask a question or share your story, just press *3 on your phone. You will then be transferred to one of our staff members who can assist you. You can also press *3 if you'd simply like to leave a comment or if you have an issue that you need help with. A member of our staff will be there. We're going to try to get through as many of your questions and stories as possible today. But don't forget that you'll always be able to find more information about many of the topics we discuss by visiting Congresswoman Castor's website at www.castor.house.gov or by following her on Facebook and Twitter. So don't forget *3 to ask a question. Well, now it's time to welcome Congresswoman Castor, who is Tampa Bay's voice in Congress. Congresswoman, would you like to get us started?
Thank you, Laura, and thanks to everyone who has joined our telephone town hall this afternoon. As you know, I've held these telephone town halls almost weekly during the COVID pandemic to keep you updated on the emergency aid packages from Congress, such as the unemployment insurance, the paycheck protection, additional aid to our small businesses, but also to make sure that you have direct contact with the top medical and public health professionals from the Tampa Bay area. And we are very fortunate this afternoon to have Dr. Perez-Colon from USF and also Dr. Anand from Baycare. These are our leading health experts. They're the ones who are on the front lines. And I just want to start by thanking both doctors and all of the healthcare workers, all of the nurses, doctors, all of the essential employees and workers out there that are doing everything they can to keep us safe. We are in a very, very dire situation right now. I think in May and June, we became a little too complacent. We didn't listen to the public health experts as we should have. We haven't had the leadership at the top that has consistently advised, wash your hands, don't go out into crowds, wear your mask, take care of your families and keep them safe. So I want to convey to everyone today that it is really time for all of us to take personal responsibility for our families, to keep them safe and to ramp up all of these public health measures. We had an unfortunate report today that Florida recorded 133 new deaths over the past 24 hours. That's the most since the start of the pandemic. God bless all of the families who have lost a loved one in the state of Florida now. That's over 4,500 individuals over the past few months. Our weekly average, the mortality rate is up. The positivity rates are fluctuating a little bit, and the number of confirmed cases, they're really off the charts compared to what we have seen. The Congress has provided extensive resources to states to ramp up the testing, to ramp up the contact tracing and treatment, and it's unfortunate we haven't been able to, the state of Florida has not been able to ramp up the rapid, widespread testing and then tracing isolation that we've seen happen in other countries where they've been able to better control the spread. So what I'm hearing from hospital leaders in this area is that they have more patients than ever. They have some staffing shortages. Many of them have been working nonstop for many months. Some have contracted COVID, so they have to stay out of the hospital. We're having to recruit folks from outside the area to come and fill in some of the gaps. So it's really incumbent upon all of us. We value all of the healthcare workers, are fantastic hospitals. It's incumbent upon all of us to do our part to stay home whenever possible, be sure we're wearing masks and listening to the public health experts. So I'm going to turn it over to the doctors first, and we'll hear from them. If you would like to ask a question, please hit *3 and get in the queue to ask a question. I'm eager to hear your questions as well. So I'll turn it over to Dr. Perez-Colon. Welcome.
Thank you so much, Congresswoman Castor. Thank you for that introduction. I think it's very, very important that we emphasize that we are in a very bad situation right now in Florida. There is a couple of things that I would like to highlight out of our experience at the COVID confirmed clinic through USF, as well as our partner hospital, Tampa General Hospital. One of the things that Congresswoman Castor mentioned is that the amount of cases have been significantly increasing over the past couple of weeks, and that is exactly what we're seeing in the hospital. The hospital admissions are going to lag behind a little bit from the increase in the cases, as most of the patients develop severe symptoms anywhere from day 4 to day 10 of the illness. At Tampa General Hospital specifically, we have seen, right now, we are seeing 3 to 4 times more patients than what we were seeing back in May and June. So we are seeing a significant increase in the cases. We're also seeing a significant increase in the patients that are in the intensive care unit as a consequence. It is important to emphasize that though the case fatality rate or the mortality, which a lot of people are more familiar with that term, hasn't significantly increased, even though today we had the highest death day in Florida thus far. This is going to lag a little bit behind because we have a lot of heroic measurements that we can do to keep these patients alive and supported. So we haven't seen the worst of it, unfortunately. There are other factors that play into that a little bit, and one of the main factors is the mean age in Florida. When you look at the amount of pediatric patients and patients that are younger that have been diagnosed in Florida is significantly higher than other areas, and that definitely does play as well into the mortality. But the message that I want to convey is that the most important part of all of this is really the morbidity, which means not only whether the patient dies or not, but the consequences from this disease. We are seeing patients requiring oxygen, having symptoms for up to months in the clinic, having cardiovascular problems, lung issues that may be long-term issues, we don't know yet, strokes and other medical conditions that have been related to COVID-19. And that is more important to us because these patients are going to be dealing with these consequences for a long time, if not permanently. We have been collecting data for about 3,000 patients that we have seen in our clinic, a little bit more than 3,000. And a couple of things that we have found that is very important to share with you is that 87% of the patients that we have interviewed in the clinic were not wearing a mask, or they were not wearing a mask properly, and they got diagnosed with COVID-19. So this really goes with all of the information and data that is reporting that mask usage definitely decreased the spread of the SARS coronavirus 2, the virus that causes COVID-19. The other interesting thing that we're finding is that there are a couple of places that we find that patients have gotten the infection from. Bars and restaurants are one of the common ones, churches, as well as family gatherings. So this is not the moment to, we are very social beings. However, this is not the moment to be gathering in big groups, and really you shouldn't be in contact with anyone that is not in your same household. We're also seeing a little bit of disparity in the data that we're collecting, with 38% of patients in the clinic being Latino patients and 25% being Black patients. This is higher than the numbers of citizens that we have with that race and respective race and ethnicity. So it's important that we continue to not let our guard down. Things that you can do to protect your family is no gatherings, not really being in crowded spaces. If you absolutely have to be, because it's essential that you are, and you're inside, you definitely have to wear a mask. If it's recirculating air, like in most establishments, grocery stores, etc., eye protection is also highly recommended. And maintaining social distancing and washing your hands frequently.
Great. Thank you, Dr. Perez-Colon. We're now going to turn it over to Dr. Anand. You have a few.
Okay, perfect. Thank you. And Congressman Castor, thanks for having me on. I really appreciate all the efforts that the group has put in. And Dr. Perez-Colon, I think you summarized a lot of the medical aspects pretty well. Just a couple things I want to do. I'll frame my comments in a little bit of optimism, a lot of concern, and with a framework, hopefully, of hope as we look towards the future. On an optimistic note, we, from a health system perspective, we are much better prepared than we were back in March, and I credit a lot of different folks in Congress has been really helpful for us. Personal protective equipment was a big gap for a lot of the healthcare providers, and that's why healthcare providers were getting sick in the beginning across the country. Now, if you go into any of our hospitals and daycare, all of the people are wearing masks. They've got eye protection. They've got gowns as they need it. So that we are in a much better position. We've also learned a lot about the virus. In the beginning, there was a rush to put people on ventilators, and so if people had difficulty breathing, we'd rush as a medical community to put them on ventilators. We've learned a lot about how to treat them more effectively, put them on oxygen, even take care of people as an outpatient. So that knowledge is going to continue to go and increase. So that's the optimistic side. A lot of concern. I think this has been summarized extremely well. We're seeing a change in the month of May, at least within the Baker Health System. Most of the people that were being admitted to the hospital were from nursing homes. We worked a lot, great partnerships with the nursing homes in the state and the county to basically educate, help support the nursing homes. But we saw a big shift in June, and that continues. In the month of June, we run a lot of testing sites. We've tested over 100,000 people. And with that data, we've noticed in June that the predominant people testing positive were of the age 18 to 35. So that age group 18 to 35 were the ones that were coming into contact. And it was, like Dr. Perez-Colon mentioned, it was bars, it was restaurants, it was other sites where people came in. And they really didn't have as much severe symptoms, so they were able to spread it unknowingly to other individuals. Well, now fast forward to the month of July, and we're seeing the predominant age group now from 18 all the way up to 60. And that's a particular concern for us because we know that as people go into the 60 age group, 70, 80, your likelihood of being admitted to the hospital increases. As we look at Baycare, we've expanded our services across the continuum. We operate drive-thrus, and we're seeing the demand for testing, people who have symptoms who need to be tested, continuing to increase. And woefully, I hate saying this, but while we have more testing capability, we're still not able to meet the needs of the community as a whole medical community. So we need to test more. Of the people we're testing, 1 out of every 5 is actually coming back positive. And so that's a pretty significant amount because that tells us that we're not testing enough. And of the people we're testing, a lot of them are coming back positive. The turnaround times for some of the lab and the testing, and I know this is really frustrating for the community, but that we're noticing that's increasing again. It had gone down to 1 to 2 days to get the results, and now we're seeing that go up to 5 days. And so that's something that we're going to continue to work with our partners to try to improve. On the hospitalization side, I think Dr. Perez-Colon mentioned it. We've had a 3 times increase, the 300% increase in the number of patients from the end of May to now. So we are seeing people being admitted. A lot of them most of them tend to go home, but also our ICUs are starting to fill up. We've actually seen roughly about 30 to 35% of our total ICU beds, our ICU patients have COVID in there. So we're seeing COVID kind of become more of the patients we see. We've separated within our hospitals COVID patients, and we have a lot of prevention places and practices in place, and then we've got non-COVID areas so we can keep everyone safe as we go forward. But that trend's concerning. I mean, as I talk to my counterparts in New York and Houston and Arizona, all places I've trained, I mean, they basically, when hospital capacity gets really tight, that's when the death rate goes up because people can't get the care they need. The good thing from our community standpoint is all the health systems are working together, and in addition with the county. So we've got plans in place, and we've been able to expand the number of people that we bring in, like Congresswoman Castor alluded to. We'll continue to do that. We can expand into other beds and create some additional capacity. But I think we all have to be mindful that this virus is here. It's real. It's got significant complications, like Dr. Perez-Colon mentioned, heart attacks, strokes, clots, all sorts of different complications that can result. And so, we'll continue to meet the needs of the community. We're going to do everything we can with that partnership. I am really concerned about the death rate, and because I do think it lags. And as people get into the hospital, as the number of people increases, which we've seen, again, 300% increase, who have COVID, there will be people who have really bad outcomes, unfortunately. So we have to continue to treat them. I also want to kind of end a little bit on the hope side. As you go out in the community, you notice that people are wearing masks much more than they were before. So there is hope out there. You see people are really intentional. I always have to remind them to pick the nose above them, or pick the mask above the nose, but they're wearing masks. They're also socially distancing. So if you're running, people will cross farther away from you. So with that, I think there's some hope in there, but I think we're at a crucial time, and we've got to double down on all those safety practices. We've got the hospital perspective. We're going to continue to increase our bed capacity. And then the things that Congresswoman Castor alluded to, contact tracing, we're going to need some help and assistance to be able to get enough resources in the community to be able to help with that. So a little bit of hope at the end of this journey.
Thank you, Dr. Anand and Dr. Perez-Colon. We appreciate your comments.
Yeah, and Doctor, thank you both. I have hope as well, because I saw how the community responded early on in March and April, and we just have to do that again. And just know that the Congress, the House of Representatives, a few months ago, we passed additional resources to honor our heroes. It's called the HEROES Act, that would provide additional resources to pay our vital workers, like our first responders, our health workers, others who are maybe at risk of losing their job because local revenues have fallen off. But we've also established in that HEROES Act a fund to ensure that essential workers who have risked their lives working during the pandemic receive hazard pay, and then another tranche of big money for the coronavirus testing, contact tracing, isolation, that'll really help ensure that every American can access the free coronavirus treatment, and that will help support our local hospitals and providers. So we're going to keep pressing the U.S. Senate and the Trump administration to begin to negotiate with us on that, but I think it's clear right now we need action. So, Laura, I'm eager to hear questions from folks who are on the line, so why don't we get started?
Great. We are ready to get started. Our first caller is Yvette. Yvette, you are live on the line if you want to go ahead and ask your question.
Yes. Hi. I was calling because I would just like to know if you're around somebody and they, had symptoms of COVID and you don't know if their tests are coming back positive or not, but you've been around this person and you don't know it, so you're walking, you're around, I'm around my grandkids and everything, not knowing if I have anything or not, and it's just worrying me because their children, like you say, they might not get, but 11-year-old child just died from it, so we can't say children can't catch, you know. And I'm just trying to figure out what do we do? How can we help ourselves, and especially people that don't have income like that, and being black and in the low income area, that's very hard for us.
It sure is.
Yeah.
Doctors, what do you advise someone that, like Yvette, who has been around someone who may have symptoms and they're together as a family? What do you advise?
Yvette, this is Dr. Anand. I really appreciate your question. I know it can be some trying times. A couple things. Whenever possible, I always advise, it's a little bit harder around family, but the same things we talked about. When you go out, wear a mask, try to keep a little bit of distance, and wash your hands. If there is some concern someone in your house has those symptoms, again, fever, they've got difficulty breathing, they've got a cough, anything like that, I would first have them seek out care with their medical provider. If you don't have one, there are community sites where you can get them tested as well as yourself based on your symptoms. And so I would get them tested just so you know they either have it or they don't, and that can help inform kind of what you do next after that.
Right. And so because I'm sorry.
Well, I was just going to add that absolutely, I agree. And I think that while we are waiting for results, it's important that we wear masks to try to minimize the spread if they were to be positive. So it's important that that is a step that to be taken while we are waiting for results as well.
All right. And
Yvette, do you know where the closest place to get tested is in your neighborhood? If you
Stadium, the Tampa Bay Stadium.
Mhm.
That's right around the corner from my house. Well, not right around the corner, but I'm closer to the Tampa Bay Stadium and everything. But it's just so hard, if I have to go there, I will. But if my car doesn't have air conditioning, and you got to sit there for at least 3 or 4 hours waiting, and and it's so hot. But I would sit there until the nightfall if I had to. That's my thing that I have to do to make sure, even if something happened to me, my grandkids will be okay.
Well, for Yvette and anyone else who is on the line who really feels like they need to get tested, I want you to. We have your information, and Yvette, we can get back with you to make sure you don't have to wait out for hours with no air conditioning. But anyone else who's on the line and in queue who has some significant need for a test right now, please leave a comment at the end of the call, and we will call you back and try to help you. The testing situation is completely frustrating, especially I was advised yesterday that $8 billion that the Congress appropriated to the Trump administration is still sitting in Washington, and they have not done what they needed to do to get the supply chains working. I understand, doctors, we have a shortage of some of the testing materials and reagents, and that's part of the reason we have slow results back. We can go on to the next question, Laura, too.
Great. Thank you, Yvette, for your question. Our next caller is Thomas. Thomas, you are live on the line if you want to go ahead and ask your question.
Yes. Part of it's already been answered by the fact that the doctor says that they're in better shape with some of the PPE and other things. My question is how much stockpiling we've done in the months since we started to do things under the War Powers Act, and how big of a stockpile do we have on all of the necessary preventive and treatment equipment?
Yeah, I know that Dr. Anand talked a little bit about the Bay Care system. At Tampa General Hospital, we have a similar situation. We have enough PPE for our providers to stay safe themselves and keep all the patients safe as well at the time.
Yeah, and this is Dr. Anand. I think Thomas, from your perspective, the supply lines have improved. I'm cautious to say that I still think we need more. We still have some of the typical suppliers. Sometimes the product's delayed. Sometimes it takes a little bit longer. Sometimes we're not sure if it's going to come. And so given the time frame that we've come from, it's gotten much better than it is, but I still think we have some opportunity. And Congresswoman Castor had talked a little bit about the testing side. And the chemicals that help us run the test, called reagents, we're still having some challenges with that. Again, better than where we were, but there is such a huge demand in the community. And to continue to meet that, especially as we head into the fall, we'll need to continue to take more advantage of the supply lines and improve that product so we can help serve the community.
Well, thank you very much. I do have a brief question for Ms. Castor. I sit here and I'm a senior. Wife's a senior. We both have underlying issues, so we are concerned about everything. My biggest amazement is the political people who are in the position to create and actually enforce, demand, and mandate things that are quite simple. Why isn't that taking place, like a statewide mask ordinance?
It's unclear to me why we can't have better leadership when it comes to the supply chains. I understand that really the Defense Production Act has not been utilized as it should. I was on the line with a couple of public health experts yesterday afternoon. They said, but it's not too late. We can still get back on track. We just need that national leadership. And one of the strategies they were suggesting is have states kind of band together so that they're not competing against each other. And I understand from some of the local health systems here, they're having better luck from their longtime suppliers than from the federal government to provide the critical supplies. But it's not too late. We can do this, and the funds have been provided. And I hope it hasn't taken this uptick in cases here in our state to get folks' attention.
You say you can take it, we have the funds and all that, but is it being done, and has it being done in the past? I mean, are we in the position now where we have what we need, and if it increases, will we have that stockpile at ready?
I'm very concerned. I'm very concerned that we don't have the national leadership, the national plan, and that we don't have the leadership to call all hands on deck here in the state of Florida right now. I'll just be straight with you. Here we are 4 months into the pandemic, and they haven't even appropriated or sent the funds to the states that we need for the rapid, widespread testing. They haven't done what they need to do on supply chains, and we're going to keep pressing them to do that, and that's part of what is in the HEROES Act that has been passed by the House of Representatives and is waiting action in the U.S. Senate.
Great. Thank you, Congresswoman, and thank you to Thomas for your questions. Our next caller is Jacqueline. Jacqueline, you are live on the line if you want to ask your question.
Hi, my name is Jacqueline Muir, and my biggest concern right now is the push to open all Florida schools. And we need, as parents, to have solid plans. And there is so much unknown. And with the Hillsborough County start date of August 10th, how are you going to help this issue with a solution? What is your plan and your position?
Great. Thank you, Jacqueline. I'm listening to public health experts, and what I'm hearing from them is that when you have a raging inferno, you don't run back into the raging inferno. I think if we had been able to control the spread over the past few months and had the widespread and rapid testing, you could look at a strategy to open schools. But my position is right now that it would not be safe or appropriate right now to reopen the public schools and go full speed ahead. I thought the superintendent was developing a good plan that would give families an option for children to attend or to learn at home or some other option. That's not ideal. But now I think it's so concerning. I think the rise in cases is so concerning that they're going to have to go back and relook and really listen to the public health experts. What do you think?
I'm hoping on Thursday's meeting they're going to at least push the start date so that they have time. Nobody's being the voice of the teacher. And as a former Hill County teacher, for those people, because they're being asked to do more than we're seeing our officials do behind their computers on their Zoom calls. You know, when the school board wants to all meet together in the same room, and add some kids to the mix, then we can talk about putting these teachers back in the classrooms. And we have to talk about subs. You know, there was always a sub shortage. And typically what we would do is we would break up the kids if we couldn't get a sub, and they would get mixed in with other teachers in that age group. Well, we can't do that now. We're talking about social distancing. We're talking about all these things that are almost impossible. But we're still just pushing to push everybody back in there. And I'm a small business owner, and so is my husband, and I know we need people to help us with our children. But right now we need like logical solutions, and I don't feel like that's being discussed because I'm not sure anybody, especially with a new superintendent, really understands the 7th largest school district and the needs. And where is this town hall that was supposed to be held? All of us parents who had questions. You know, how are we elected officials to what they are supposed to do is hear our voice and make change?
Yeah, I know it's been too chaotic because the school district was planning kind of this bifurcated plan, and then the announcement came down from the state of Florida and the governor that they're directing that all schools must open just as business as usual, and that's been the message from the Trump administration too. But it's probably the most important thing we can do is have schools open, but you have to have them. If you're going to do that, you have to do it safely. And I'm afraid we lost ground over the past few months, and now we have greater infection rates, positivity rates. All of this is just waving red flags, and I think a pause on this and trying to get a handle on it again so we can flatten the curve and get the supplies we need here. You know, out of the CARES Act, there was $54 million supposed to be on its way to Hillsborough County Public Schools. It had to stop at the state, and the state still hasn't delivered those monies. Those are critical monies to make sure that kids can do the e-learning, that teachers and schools have the supplies they need and the PPE and can enact these protocols. And it just seems to me that we're not there and we're not ready. And then it's not safe.
Someone, make some wise decisions quickly so that parents can plan. I mean, we can figure this out. We just have to be creative in how we do it. And with 3 weeks left, there's no time for parents to be creative, to work with a neighbor and say, okay, I'm gonna work from home this day. You ask your employer if you can work from home the next day, and for a little bit small, but we've got to figure this out because we've got to work and our kids have got to do some type of learning. And we have to talk about the social emotional needs of these children. They're not just going to jump on e-learning and start making games. Right? They need some connection and some community and some consistency. And I don't care if my children are any games this year. What I just want them to be is well adjusted, healthy, and safe.
That's well said, Jacqueline. Very well said.
Thank you, Jacqueline, for your question. Our next caller is Carmen. Carmen, you are live on the line if you want to go ahead and ask your question.
Hi, good afternoon. Thank you for all the wonderful information that you're giving. I wanted to ask a question to the doctors. First of all, kudos to Baycare. I experienced the one on Van Dyke with my father, who was transferred from an assisted living, and they were just more than wonderful, especially on keeping families notified on what was happening, because it's so hard to have a loved one in the hospital and not being able to be there to hold their hand or to see what's going on. So they did an excellent job. My question is, my father was in an assisted living where COVID started with the employees. 42 employees tested positive. They weren't wearing the proper gear when they were dealing with the residents. So what happened was 80% of their residents tested positive for COVID. My father made it, and I'm very thankful for that. My concern is when he, 10 days after he was in the hospital, had no symptoms and was feeling great, considering he's 90 years old and has a lot of underlying conditions. But at the same time, he had to be transferred to ACLF that is accepting COVID patients because he tested positive. Now, with him feeling great, the person in the bed next to him is coughing and running a fever. Would he be able to contact anything again with that, with being around other people who are infected with symptoms?
Well, that is a great question. And I think we have learned a lot more about the virus as we have progressed through the pandemic. But one thing that is uncertain at this point is immunity. We do know that patients that produce the immunoglobulins, which is what we look at, one of the things that we look at, some of the reports suggest that that doesn't last very long as we thought initially. However, with that said, there is a lot of other types of immunity that are going to last a little bit longer. And with that said, we haven't really seen any reports within the U.S. of possible reinfection with COVID. So just to give a little bit of a overview, patients tend to be infectious for about 10 days or so. Some reports say could be 8 days, as long as their respiratory symptoms are improving and they don't have fever. And as such, the chances of your dad contracting SARS coronavirus 2 or COVID-19 again is very low. We can say with certainty at this point, because the pandemic is too recent, if that is the case or not. But everything, all of the data that we have at this point is pointing towards once you have COVID-19, you seem to have immunity, meaning that you cannot get it again, at least for a little while.
And Carmen, this is Dr. Anand. Yeah, and just to echo that, I mean, I'm glad sorry this happened to your father. I'm glad he's doing better. That's what we've been seeing too. We've had several patients who came from either an assisted living facility or a nursing home. They tend to be positive for the virus, meaning they tend to have the virus in their system, even though they're doing great. We don't want to send them back to their facility for risk of exposing everyone all over again and starting that whole cycle again. And so that's why these facilities have been created out there. And we haven't seen anyone getting reinfected or getting exposed again to that. So people have tended to do pretty well.
I appreciate it.
Thank you, Carmen. We're now going to move on to our next caller is Eric. Eric, you are live on the line if you want to go ahead with your question.
Good afternoon to our guests, and thank you, Congresswoman, for having these live audiences in the town halls. To the doctors, and then the last one is for you, Congresswoman. The concern that I have is I overheard a conversation of my wife and her girlfriends having a conversation, and to my surprise, they were speaking a lot about the psychological and emotional issues that many of them and their families were having. And my wife and I talked about it a couple of weeks earlier, but I'm assuming that what's being done about that? And then, Congresswoman, this is where I'm headed with a question for you. And that is, we're talking about testing and reagents and PPE, both for the medical community. The money is there. We're not sure why it's being held up, whether it's being held up at the national level or if it's being held up at the state level. Why isn't it that we, the taxpayers who've already paid this money towards getting the materials done within the supply chain, why can't they just get it done?
I think, Eric, this is Dr. Anand. The first part of your question, so we are very concerned about the psychological and emotional toll this is taking. As you look at anything for a short period of time, if it's a day or 2 days, people can really recover. They can kind of rejuvenate and be back to normal. When you see something like this, where you're worried, you get constant anxiety, constant stress, financial, physical, emotional on there, it does take a toll on individuals. And so, I think just being aware of that's the first step. There's resources out in the community to be able to help with that. Getting out, being in Florida, and especially being able to get out and stay away from folks, but being able to at least have some changes in surrounding is going to be important. And I think we're going to have to continue to address that. I think that's where Congress has been great with some of the funding, and there's programs that have been funded because of that. And we're going to need some of those programs as we go forward. But I don't think we can underestimate the toll that this is going to take, has taken already, and we're going to need to continue to acknowledge that. And as we plan for the future, we're going to have to continue to add more resources for folks.
I absolutely agree. We definitely have seen the impact that this can take in the emotional health of the patients that have suffered through it and their caregivers. I think it's important to emphasize kind of what was said before. These patients are in a very vulnerable position and they're by themselves. So it is a very important issue that we need to address.
And Eric, why hasn't there been a better coordinated response? Why can't we get the funds that Congress has appropriated down to the local level? It all comes back to who's in charge and who's calling the shots. And when you have a leader who says this is going to go away or is not wearing a mask and continues to go out in large crowds and doesn't listen to scientists and public health experts, that's a recipe for more people dying, unfortunately. And I don't like to get overtly political on these calls, but President
we
has not
understand.
served us well. He hasn't served us well, and the governor, I think, has been in over his head as well, and that's why it's important now that we all take personal responsibility. We band together here on the local level to look out for our neighbors and our families, and then continue to press our senators, Senator Scott and Senator Rubio, and I hear you, and this is going to be difficult because we don't have a vaccine, and it will continue to wear on people's mental health and our ability to get kids back into school, and that's why we really need bold, ambitious action now. Other countries have done it. Compare us to other countries across the globe who acted swiftly, and they had consistent messaging and direction. They were able to control the spread, and it's not too late for us to do the same thing. We're the United States of America. We can do this, but we do need a national leader and governor who can be that listens to the public health experts and follows through.
I believe that we have come to a place, at least in my head, where I believe that America, all of us, we're stronger than what we're looking right now. I believe that we're wealthier than what we're looking right now. We have found ourselves not necessarily protecting the medical community because those are our frontline folks. Absolutely, they need to be protected with the proper equipment. And they've been screaming and screaming and screaming for it, and nothing has happened. And now you got, we're 300 million plus strong. And so now we who are in the civilian arena, we have no idea what the best mask is to put on. And even if we knew what the best mask was, it's not even available. So why can't we just build a facility, much like some of the folks that we saw build a hospital in 7 days? I won't even mention the name, but we saw that happen in our eyes. Why can't we build something and we can produce? We're producers. So why can't we produce PPE for the entire population? We sent out stimulus checks. I know that's for the economy, but guess what? People are dying from a public health issue. This pandemic is real, and it's not playing with us. And yet we have no idea on the very lowest level which mask is the safest one for us.
Hey, thank you, Eric. I hear you, and I bet the doctors can talk specifically about the best type of mask, but I am a little bit heartened by all of the folks I've seen across Tampa and this area who have been making their own masks and distributing them and working at Feeding Tampa Bay and just dropping off meals so that neighbors don't have to go out, especially if they have an underlying condition. I think you're right, that same spirit, we can capture it and do big things and control the spread. And doctors, do you all want to weigh in on the best type of masks and give us a little tutorial on how to wear them and materials?
Yeah, this is Dr. Anand. So I think a couple things. First of all, thanks for your passion. I agree with you about the country. We can do anything when we put our mind to it, and I think we've got to Congressman Castor, we've got to kind of move forward with it. For Baycare, when this first started, we actually mobilized nurses to get sewing machines and make our own personal protective equipment. So we were kind of in the midst of this as well. Your question about mask, if you're out there in the community, what I recommend is if you can get a medical grade mask, that's obviously going to be the best. I don't think you need the N95s, which are the real fancy ones. We should save those for the healthcare workers who need it the most. But if you can get a medical grade mask, that's will have some good protection. If you can't get that and you have a cloth mask, that's going to work well in most circumstances. When it tends to get wet, you have to be a little careful with it. If you only have a bandana or something like a sheet, I recommend getting as many layers as you can to kind of cover your mouth so that you have that added level of protection. And regardless of what mask you use, you should try to maintain that 6 feet from other folks, because that's going to give you the best protection, is actually having that distance in there when you can.
I agree, and I think this is Dr. Perez-Colon. There is some good data for even cloth masks, and ideally surgical masks should be used, but N95 should be reserved, as Dr. Anand said, for healthcare providers. And I think one important point to point out is that a lot of people feel that the oxygenation or ventilation, the carbon dioxide, is going to be affected through the usage of masks, and then that is not correct. I think it's important to continuously educate the population on this. It is going to, any of the masks is going to confer some protection, one more than others, depending on the material that is made out of. But it is important that you're going to be able to oxygenate just fine. You're going to be able to breathe just fine. So it's completely safe.
Great. Thank you, doctors, and thank you, Eric. Our next question comes from Michelle. Michelle, you are live on the line. If you want to go ahead with your question.
Yes, hi. So I'm a realtor, and as an independent contractor, when all of this broke loose, I had people canceling whether if it was their listing or purchase. And at that time then, the only thing we could possibly hope and wait for was going to be the check. Well, I don't have direct deposit because I pay out. So I was going to have to wait for a check to get mailed to me with somebody's signature on it, and wait that delay. And then come to find out that I couldn't get on the website for unemployment, and then to come find out that as an independent contractor, the governor did not sign off for independent contractors to be able to receive the benefit, and just so many different things. And then honestly, I prayed that I would not have to receive any of that money at all. But I know that there's some people who are not in my position to where, I did end up getting an influx of, some people coming in, but I'm still seeing it is affecting my bottom line because had an appraiser get the coronavirus, so now it had to get canceled, and now so we're pushed 2 weeks out. And I don't know about you, but if I don't get a paycheck for 2 weeks longer than what I was planning, it does affect. And I've had ones actually cancel because somebody, their hours got cut, so now they no longer qualified. So it has affected my bottom line, and I would really like to not have to get that money, but I know that there's tens of thousands of realtors who did, or just even independent contractors who did rely on, their source of income as 100%. I don't have a spouse, so if we don't have that income coming in and we don't qualify for anything, are we just, left out? To just kind of like bear, to try to just bear, we don't qualify for anything as realtors.
Yeah, Michelle, hang in there. I want to get my constituent service team with you probably tomorrow to go through some of the options that are out there and just to make sure that there wasn't another avenue through some of the emergency aid. Some of the CARES Act funds have arrived at Hillsborough County and the city of Tampa, and they do have some bridge loans and outright grants through the emergency aid provided by Congress to help small business owners kind of get through this really difficult period. But I want to have my folks kind of sit down with you and go through some of the options to make sure we're not leaving any stone unturned.
Great. Thank you, Michelle. Thank you, Congresswoman. It appears that we have time for just one more caller today. I do want to just remind everybody, if we were not able to get your call live on the call today, to please remember that you can stay on the line and leave a message after the call. You also don't hesitate to call our Tampa office at 813-871-2817. Congresswoman, our last caller is Sam. Sam is live on the line. Go ahead and ask your question.
Yes, I'm 65 years old. Last year I was in ICU for 4 days for diabetic reasoning. I'm an optician. My office was closed on the 20th of March when the cases were very low. So my benefits for unemployment are going to run out in August 1st. So my choices are to stay out of work, exhaust my savings, and wait for a vaccine, or I could put myself out to look for a job, which is difficult because of the virus, and then put myself at risk of catching the virus. If you were me, which course would you take, either to put myself at risk or to exhaust my savings until a vaccine is available?
Wow, Sam, you're in a difficult circumstance, and you're not alone. There are a lot of other folks who are struggling with those same issues. I can talk a little bit about some of the financial options, but doctors, maybe you want to provide a little general advice for a person around the age of 65 who has some underlying conditions and the type of precautions they should be taking.
And this is Dr. Anand, I think, and I'll let Dr. Perez-Colon just to add on to this. I think just in general, I think you have to be a little extra careful. And I agree with Congresswoman Castor. It's a tough conundrum. that you're in. But I think things that you can do, just like we've talked about throughout this conversation, the best you can is I would get a good quality mask when you have to be around people. I would try to limit interactions around anyone who's coughing, who has any symptoms that may be typical of COVID as best as you can, and then just either hand sanitizer or wash your hands as much as you can when you do have to go outside. I know it's a tough challenge and stuff, but I do think you have to be a little bit extra careful because, like you alluded to, your diabetes that you have.
I have to agree. I think, of course, you have multiple risk factors, and taking those extra steps to protect yourself will be extremely necessary. Avoiding gatherings and areas that are crowded will be extremely important in your situation. And when you cannot maintain that safe distance, then wearing a mask is strongly advised.
Yeah, and financially, I think my colleagues in the House, we recognize that this is an unprecedented public health crisis, and it calls for unprecedented action. And you've seen that through the CARES Act funding and the other emergency aid packages. We've also in the House passed the HEROES Act, and for folks who are interested and need another direct payment, those stimulus payments of $1,200 per family, up to $6,000 per household. We have in the House, we've passed another round of those stimulus checks. We've also extended the payroll protection program. If you're a small business owner that needs that emergency loan that is turned into a grant, if you qualify, that could be an option for you. We want to make sure that it really does get to the underserved communities and nonprofit groups that are truly small businesses. There are also emergency or economic injury disaster loans available, and my team is happy to get on the line and kind of work through some of those options. And then we, in the HEROES Act, we also extended the weekly $600 federal unemployment payment through next January. That should provide a safety net for millions of Americans who are unemployed or cannot work because of COVID. We're also doing everything we can to protect Americans from losing their health insurance by providing subsidies for COBRA so that folks can maintain their coverage. And we, in the HEROES Act, we also created a special enrollment period under the Affordable Care Act under healthcare.gov for uninsured Americans, so that there wouldn't be a barrier. And most people in Florida, over 1 million Floridians already sign up for their health care through the Affordable Care Act, and most receive tax credits that help make it affordable, and the need is going to grow. It would also be helpful if the state of Florida would expand Medicaid. That almost every state in the country has expanded Medicaid. Medicaid was expanded under the Affordable Care Act to cover working class families, and that would go a long way in the middle of a pandemic to providing for the healthcare needs of a lot of our neighbors, including mental health care, because Medicaid is the largest funder and provider of mental health care across America. So let's get on the line, Sam, maybe tomorrow and try to work through some of those options, and maybe there's something else that can help you, but hang in there.
Thanks so much.
Great, thank you, Sam. And a reminder to Sam and Michelle, who's on the line before, we do have your information available, and for anybody that we said we would follow up with, our office will follow up with you tomorrow. Unfortunately, that was all the time we had for callers today. Again, if you'd like to leave a message after the call, please stay on the line. Just don't forget to leave your contact information, including an email address or phone number. But Congresswoman Castor, would you like to say any last words?
Hey, thanks, Laura. I really want to thank Dr. Anand and Dr. Perez-Colon for answering questions today, and just know that our community is grateful for all of your work. Please share that with your colleagues and all of the healthcare folks on the front lines who are dealing with the surge in care. And then I just want to relay to our neighbors across Tampa and the Tampa Bay area to please call on me and my team. We are here to help you. We're here to help connect you to resources and answer any questions. If we can help you, we want to do that. That's why we're here. And then watching the rising positivity rates and the surge that we're in this public health crisis, I really want to ask you all to help spread the word about how serious this is right now and everything that we need to be doing to flatten the curve. I know that a lot of people have to get out there and work, but if you can work at home and cut out the unnecessary trips, right now is the time to do it. That will give us more breathing room in the weeks and months ahead. And if you do feel like you're at your wit's end, you're at the end of your rope, you don't know where to turn, the Crisis Center of Tampa Bay at 211 is a great resource. They're there 24/7 to help you, to answer questions, to connect you to resources. And I hold them up because they're doing wonderful work in serving all of our neighbors, especially those who are really feeling closed in and they're not sure where to turn. So thanks everybody for doing your part to stay home and stay safe. And thanks again to our doctors and experts on the line. I'm listening to you and taking everything you say to heart. So thanks everybody, and thanks Laura.
Great. Thank you. Have a good night, everyone.